If you come across someone that's not responsive, they're not breathing, we need to start some CPR. Now make sure the area is clear of danger before commencing. And it's also very important that we get help on the way. So get someone to call 000. Safety equipment is also important. So if you have some gloves, get your gloves on. If you have a face shield, maybe on a key ring, you can use that as well. But first, we need to make sure that the airway is clear. Open the mouth and have a quick look. Tilt the head back, get down close, look, listen, and feel. If they're not breathing, we're going to start some CPR. Heel of the hand, center of the chest, 30 compressions. We're going to go at around 100 to 120 beats a minute, 1/3 the depth of the chest. And we're going to continue our 30 compressions, and then we're going to deliver a couple of rescue breaths. In delivering the rescue breaths, tilt the head back and breathe. When we breathe, we only want to breathe to get the chest to move just a little bit. Not too much. We don't want to overinflate. Just a little bit of movement in the chest. Straight back to our 30 compressions, and we're going to continue on. Once we've done our next 30 compressions, we're going back to our breaths. Now, it's very important to understand that CPR should be continued until such time as either the person recovers, help turns up and takes over from you, or you just physically can't continue. These days, you'll actually find public access defibrillators at many places, whether it be shopping centres, train stations, cinemas, surf life-saving clubs, gyms, wherever it may be. And it's very important to get those defibs on somebody as soon as you can. Now, if that's the case, anybody who is unresponsive and not breathing normally requires defibrillation. The defibs themselves are very simple to use. It's a matter of turning the defib on. From there, it will guide you through the process of what we need to do.
Remove all clothing from patient's chest. Look at pictures on pads. Apply pads to bare skin exactly as shown in the pictures.
The pads have directions as to where they are placed on the body. And now the machine analyzes the heart rhythm. It is very important at this stage to make sure that nobody is touching the person.
Analyzing heart rhythm. Everyone clear. Do not touch patient. Delivering shock. Shock delivered.
Once the machine has now said shock advised, our orange button is flashing. Make sure everybody is standing clear and it will deliver a shock. It will remind you to make sure that 000 has been called, and then it will go back into CPR. Just like we did before, heel of the hand, center of the chest, 30 compressions. 1/3 the depth, and you go between 100 and 120 compressions a minute. So that's the video. The next section is the quiz, a series of questions that you need to answer. You can go back to that video at any time to help you with those questions. And you can repeat the questions to get them right. Once you've got them all done correctly, that finishes the course. You will get a certificate from us of completion from that, which will show that you've done the basic CPR and you know the basics in defibrillation. Good luck with it.